Are botulinum toxin injections safe? Here are some complications you need to know. Botulinum toxin injections are widely used in aesthetic medicine and are generally considered safe when performed by trained medical professionals. However, like any medical treatment, there are potential side effects and complications that patients should be aware of. And in this video, we'll discuss some of the most common and important complications associated with botulinum toxin injections. One of the most common side effects is mild bruising or small injection marks at the treatment site. And this happens because very fine needles are used to deliver the injections, and small blood vessels may occasionally be involved. Most bruises are minor and temporary, typically resolving in a few days to a week. Applying gentle pressure after injections and avoiding blood thinning medications or supplements beforehand may help reduce the risk. Although rare, allergic reactions to botulinum toxin can occur, and symptoms include localized swelling, redness, and itching. Severe allergic reactions are extremely uncommon, but if patients experience symptoms such as difficulty breathing or widespread swelling, they should seek medical attention immediately. Another concern some patients have is the appearance of a frozen or overly stiff face. And this can happen when too much botulinum toxin is used or when injections overly weaken muscles responsible for natural facial expression. And the goal of aesthetic treatment is to get natural looking results where facial movement is preserved while the wrinkles are softened. So experienced practitioners typically adjust the dosing carefully to maintain balanced facial expression. Another potential complication of botulinum toxin injection is ptosis, which refers to drooping of the eyelid or eyebrow. And this can occur if botulinum toxin spreads to nearby muscles that help lift the eyelid or eyebrow. For example, weakening of the levator muscle responsible for lifting the eyelid can cause eyelid drooping, and weakening of the frontalis muscle that is responsible for raising the eyebrows can cause drooping of the eyebrows. And when it occurs, the ptosis is usually temporary and it gets better as the botulinum toxin wears off. Another possible complication is that of an asymmetric smile, and this happens when the botulinum toxin affects the muscle that are responsible for movement of the mouth and lips. If this happens, patients may notice an uneven movement when smiling. And again, this gets better with time as the botulinum toxin wears off. Botulinum toxin injections are widely used and are generally safe when performed by qualified medical professionals. And understanding the possible side effects and complications helps patients make an informed decision about their treatment. And if you're considering a botulinum toxin injection, choosing an experienced practitioner can help to minimize the risk and achieve natural looking results. If you're considering botulinum toxin injections, come see us at Bay Aesthetics Clinic and MediSpa. Our doctors have over 20 years of combined experience and we have treated over 4,000 patients. Our treatment philosophy focuses on natural results and patient safety. Let's stay beautiful and young together at Bay.